Thank you so much for joining us this afternoon, Commissioner. I just want to tell everyone else, welcome and thank you for joining us for today's important webinar regarding the COVID-19 vaccination distribution plan. My name is Alexandra Daslich, and I'm the Director of Government and Public Relations for the Nevada Restaurant Association. Joining us today is Clark County Commissioner Chair Marilyn Kirkpatrick, who has graciously agreed to come speak to us today on this webinar to share some information with our restaurant operators and affiliates. Please keep in mind that after the presentation, we're going to be taking time to answer your questions. So feel free to enter them into the chat box and we'll get those questions answered. Commissioner Kirkpatrick, welcome, and perhaps you want to take over from here.
Yep, no, thank you. And I'm going to try and get to your questions right away because I appreciate that you all were waiting. And really, I just kind of wanted to tell you what our scenario is so that you can understand where we're at. One, there's 35,000 vaccinations that come to the state as a whole. So we have to work through our process in a slow and methodical way, because the last thing that we want to do is waste vaccines. I can tell you to date, we're doing a really great job in Clark County and as a whole working towards that. A lot of people have asked, how was the plan put together? This was a state rollout plan based on some CDC guidance and based on some things that they have to put together. So no good deed goes unpunished. Trust me, people have been blowing me up. How could I be so awful? And I will tell you this, I didn't make the plan. However, Clark County itself has stepped in to help finance the plan so that we could have as many sites as possible so that when we get more vaccine, we can get them out quickly. Some of the reason that the 70 and older were picked is because our hospitals today are full of the 60 to 80 folks that are currently at our hospital capacity, which is, we want to make sure that they're safe. So we are working on the 70. The CDC guideline says 75, but the governor came out with a 70 or older plan. What I would tell you, there's about 208,000 seniors within that period, because we're such a great place to retire. So we're working many different ways. We are still working, believe it or not, through the medical community. We're still working through our public safety community. And one of the reasons that the frontline piece was open specifically is because I have my food banks, I have some social service workers, I have some juvenile justice folks. So we are trying to get some of those folks in. What I will tell you, at Cashman yesterday, we did well over 2,000 vaccines. At Western, they will do over 1,000 today. So we are working hard to get as many out as quickly as possible. Next week, we should see CVS, Walgreens, and Smith's, I believe it is, to start giving vaccinations. So they were the ones that have a federal contract. They were expected to start the seniors first so we could move through that other track. However, they have not gotten their direct allocation from the federal government. So at the state level, we are sharing some of our allocation with them to ensure that we can get to those seniors. So that's a broad scope of what's going on, and we are all working around the clock to try and address things. But I know that you guys had some real questions, so I want to try and for you.
Of course. I think we have one that was just submitted into our chat box. Again, everyone, please feel free to submit your questions there. I know you guys are all muted, so that's your line of communication. Our first question is, why is food service not included in the frontline supply chain category? Every other step in the food processing chain, from farm, packaging to delivery, is above the actual person who handles the food and serves it to the guest. How can you justify that?
So I can justify it because it's not the county's role, and I didn't create the plan. So I don't know, and nor did the local health authority. So the state has worked with the CDC So I'm not sure what that reasoning is for, except that maybe across the country, agriculture in some places play a big role. We know early on that we had a huge problem with transportation and supply chain, that we couldn't get products to different states around the country. And so I have to assume that there were some of those things that they've seen from the beginning of COVID taken in, but I'm happy to try and get that specific question answered from the state. But we did not, it wasn't done. We are just following the list. But I gotta believe that the CDC and the state, who've been working very closely together, there must be a reasoning behind it, and I'll try and find that reason for you.
Great. We have another question. It says, you created a separate vaccination site this week for teachers only. Why not next week set up a site that is for hospitality only? It would streamline the process of getting these important workers vaccinated quickly and efficiently.
So I'm going to go back to the 35,000 vaccines that we get every week for the entire state. There are some, remember that there are some folks, some teachers around the school that are actually in the classroom that are teaching, whether you're in Lincoln County, you're in Eureka County, Humboldt County, Washoe County. Many of our charter schools and our private schools, they have educators within the classroom. So I'm assuming that is why that was done. The reason that we created a separate pod for education is because they were bogging down the entire system for everyone. So a couple of things, we like to do individual pods for specific groups. So make no mistake that when hospitality, we get to hospitality, we are, you will see mega pods around the valley just for hospitality, because we have to be flexible on shifts. We have to accommodate the graveyard shifts, the day shifts, the night shifts. So that's always been within Clark County's plan, and we will, we already have those, many of those sites lined out, many large facilities. We've been asking our congressional delegation to please help us get more vaccines, because we all want to work back to a sense of normalcy. So that is why the separate pod was created for education, is to get them out of the rest, because there are a lot of other folks that we need to, that are crucial to our workforce, that we want to ensure that we can get to, and you are many of those folks that are crucial to our workforce.
Great. We also had some who were submitting it via email. One of the questions is, can you explain further how categories within the lanes may be vaccinated simultaneously?
So I want to be mindful, because I see that the news is on here and you have not helped me as far as getting the message out. So I want to be very careful on how I say this, because that's where half of our confusion has come. So no disrespect to Fox 5 or KLAS, but I would just want to make sure that we get the right information out, because on one hand, I have many folks that are 70 and above that are very upset that they cannot get the vaccine. And yet, on the other hand, I have crucial workforce that I need to ensure that that our community can still run in order to provide services. And so I hope that folks understand that 70 and above are, because they're the most vulnerable within our community today, and we want to get them because it helps on many different levels. And as we're looking at the tracks, we're trying to have a little bit of flexibility, because the last thing that we ever want to do is have to throw away vaccines. And we have not had to do that in Nevada. Although you're hearing about it across the country, we just need a little bit of flexibility so that our vaccines do not go to waste. We cherish each one of those vaccines that come. There are very specific rules on how you can handle each vaccine. So whether it's the Pfizer, which has to stay at a certain temperature, and you get 5 to 7 doses per every vial. What I wouldn't want to do is to open a vial with one person standing there, because I would want all 7 of them to be used. To the Moderna, which is can be at room temperature, but that's anywhere between 9 to 11 doses. And I want to make sure that I have those many people in place at the time. But we also have to be equitable across the community to ensure that we are getting that job done. And that is what we are trying very hard to do. We are hopeful that the federal direct allocation will come soon, which will allow us to move quicker, but know that we have lots of different locations set up. So in the event that we get more vaccines, that we can bring it in. And honestly, I'm super thankful for our National Guard. It takes about 90 people to run a mega site. And at Cashman, we're doing 2,000 a day. I don't know too many sites that are doing less than 1,000 a day. But if you do the math for the long term, that means it's going to take us a little while to get through there. So we are trying to get through as many as possible as soon as we can.
Great. We received another one. It says, have you considered developing a standby option that would allow eligible workers to get vaccinated early if a location finds they have leftover vaccines?
So we haven't had that issue yet, and we do, we have many, I have lists of senior citizens. Yesterday we had about 20 spots open within a couple of hours. And so I had a list of some seniors from some of our senior communities. We were calling through to see if people could get there, but we are really not due, and we take a super good inventory about 3 o'clock in the afternoon to make sure. So but I'll keep that in mind and see if there's a list that we can create. But most importantly, I specifically asked everybody to fill out that survey, because that helps us manage exactly how many people are interested in getting the vaccine so that we can move through that process.
Great. We have another one in the chat box. It says, how quickly will the county be able to get their goal of 40,000 vaccinations a week?
We'll be able to meet our goal as soon as we get that many vaccines. So right now we're waiting on that many vaccines a week.
Okay. What percentage of teachers need to be vaccinated before we can move on to other categories?
I don't have that answer. The only reason that I am, look, I feel that just by being honest with folks and trying to answer so many questions, because everything gets distorted, is why I'm doing that. I'm a health board member, so I'm super engaged in this process. The health district is the lead agency, but my role is the vice chair of the health district and the chair of the county commission. We have a great collaboration in Southern Nevada as a whole, so we are all working together. And I just wanted to take an opportunity to kind of tell you, because a lot of folks are frustrated on many different levels. And look, I don't let anybody jump the line that's not supposed to. My own husband's 68, and I'm like, you're not 70, so you're not going. I've not jumped the line. So it's just, we're trying to make sure that we get a stable workforce as well as our most vulnerable vaccinated at that time. We were on a national call with our delegation, and we're hoping in February that we will get tons and tons more vaccinations. I can vaccinate, just give me as many as you got, has been my answer to them.
Understood. Great. We just received another one. Do you have any insight into why the governor places food service workers so low on the list compared to other states in the Western US?
I don't, and here's what I would tell you. I'm not here to Monday morning quarterback anybody. This is a whole new thing that we've all been through. I wish I had time to stop and read what other states are doing right now. And I don't even know what their vaccine allocation is. So there could be many reasons, and we are working closely with the state. So I'm not here to say that.
Understood. Okay, great. Any other questions? Please feel free, you guys. There's the chat box on the right-hand side for any questions that we have. Just give it a minute.
And I wanted to say this. First of all, I want to thank our community, because many of our medical staff have stepped up. They're working tirelessly to not only through COVID, but now the vaccination process. But we really have a great community, and we all want to get some sense of normalcy and get back on track. I would love nothing more than to be able to go sit at your restaurant at 100% capacity and actually have to wait outside to get in. And there is a light at the end of the tunnel. We're moving towards that. So patience has got to go forward. We're working on some additional resources, but vaccines are our top priority. So if you talk to anybody in our national level, ask them, when can we get more vaccines? Because we're ready to go.
Great. I think we have another one from in the chat box. It says, are resorts talking with each county about how to vaccinate the thousands of strip and casino employees?
So we've always had a plan for that. So resorts are large facilities, but until we can get some vaccinations, there's not much more that we can do at this point because we are utilizing every vaccine that we have.
Great. Another question is, are the plans to move restaurants further up if more vaccines come through?
Here's what I would tell you. I have to work through the whole list today, is what I'm saying. But if we have more vaccines available, we'll be able to go quicker through that list. So I don't want to give anybody any false hopes. I don't know that, restaurant, I don't want, we're all equal in this, right? We're all needed in order to keep our community going and to recover. So the more that we get, the sooner that we can all get back to normal.
Great. We received another one from Susie. It says, how will we know when it's available for the hospitality industry? And is there going to be a hierarchy within the group?
So what I would tell you is I've asked everybody to fill out that survey so that we could manage what the number is for vaccines. And so we'll keep the list, and hopefully by the time we get to hospitality, there's not a lot of other groups out there, with the exception of maybe the 16 to 69, that we will be able to go through it just like we have with any other tier. So I don't have an answer, and here's what I would tell you is equal in this, right? Hospitality is the backbone of our community, and we need everybody to have the option to get it. But what I would also say is only about 70% of the people across the valley are interested in giving it. So filling out those guesstimates of what you would like, how many you think would do it, might give us an opportunity to have a better idea of how many in the hospitality realm would want it.
Great. We have another one from Sarah. She says, is there anything restaurants can do to prepare to get staff vaccinated more quickly when supply is available?
Yep, it's that survey that I sent out, because that really does help us manage how many folks that we need. Alexandra has that survey for you. And it really is just asking your employees how many are interested in getting the vaccine when it becomes available. And I say when it becomes available because it doesn't mean it's going to happen tomorrow. And in some states, they could be going well through October to actually handing out the vaccine. And we could see ourselves, depending on how fast we get the vaccine, going through June before most general public would open it. So we don't have a timing, except that we're working as fast and we have built the capacity so we are ready when we get more vaccines.
Great. And I know we've been working on that survey together, so I'll be sure to send that around to everybody in the group following this webinar. So that's the answer to Joe's question about where we would need to find the survey for those interested. We have one other question. Will restaurants that push their employees to vaccinate be given priority?
I don't know that. Well, I don't have the answer for that. I can't see that being. We need to we open hospitality, That's a lot of different people within hospitality, whether you have 2 employees or 2,000 employees. We recognize that, so I don't, the line is still the same, right? It was like testing, it's like vaccinations, still got to stand in that line. By then, we should have a new computer system in the next about 3 weeks that will help register even faster. So it will make us way more efficient. So our goal is to get as many people vaccinated as wanted and as soon as we can.
Wonderful.
Okay.
Any further questions? I know you've answered a lot.
No, I'd rather just have a regular dialogue so that you can hear it from me. If Facebook could go away for a week, my life would be so much better. But I'd rather just have a regular dialogue with you all so that we did this with reopening when we reopened way back in May. So we'd like to just continue a dialogue so that we can help you be successful and help us all get back to normal.
Definitely. Thank you so much for your time today, Commissioner. I know in our discussions, you've continued to tell me that you've been a friend to restaurants. You truly have. You've worked in the industry. You understand it inside and out. So when Commissioner Kirkpatrick really does talk from a place of empathy, she really does understand what restaurant employees have to kind of go through, the struggles that kind of surround that. So we really do appreciate your time today, and thank you so much for answering our questions. I'll be sure again to send out the survey to everybody so that you can answer that accordingly, and hopefully we can continue to log and have kind of regular check-ins if possible.
Nope, that would be great. And like I said, we worked with you all when we opened, and I would bet that as we open up further that we're going to want to get rid of some of the restrictions that are out there. So that is where, at some point you guys will be helpful. What's the most daunting restriction that you have? I can tell you for me what it is. Self-service drinks we should let come back. We've been trying since October, but that's where you'll be important to know specifically what kind of things can help that are really, taking a toll on the extra work. I was a waitress 22 years, so some of my best years were making sure that was way back when, a long time ago, when creamers were not non-dairy and you had to keep them on ice. The health district thought you could keep them on ice in a bowl on the table, and that sounded great, but didn't really work. But I was in the food distribution where, they were going to shut down chocolate machines because they didn't have the NSF on them at some point. And I'm like, but chocolate never stops turning. So that's why I sit on the health district, because I understand the realities of how we all have to work to be safe and to move forward. So anytime, Alexandria, I do have to get to something else. So thanks. And I'm always available to answer this. And then there is a website, there is an email where you turn the survey back into, so that we can ensure that there's a hard copy for each one of our stations. We'll have a hard copy, as well as we'll have something for the future in the event that we need it.
Wonderful. Thank you again so much, Commissioner, and thank you everybody for tuning in.
Okay, thank you.